You're welcome back. This is Newsfile. It's your most authoritative news analysis platform. And as you know, here on Newsfile, we put Ghana first. And that education takes the place of my take for this morning. I have a take on Corona chaos, revealing autocrats and democracies part 2. I'll share that with you next week. Now, I have one of my guests in the studio, Dr. Nsiah Asare. He's a presidential advisor on health. As you may have known him long before he became the presidential advisor on health, he was the boss at the Ghana Health Service. And before that, for many years, he was the CEO of the Konfanochi Teaching Hospital. Good morning, and thank you very much for joining us, Doc.
Good morning, Sam.
Great.
How are you?
I'm very good, by God's grace. Thank you. Dr. Justice Youngson, who is General Secretary of the Ghana Medical Association, should join us. And on Skype, we have Dr. John Amwesi. He's lecturer, Global Health Department, School of Public Health, KNUST, and leader, Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine. Thank you very much once again, Dr. John Amwesi, for joining us.
Thank you very much, Samson. It's a great pleasure to be with you.
Right. Many of our viewers across the globe have been very appreciative of the education that you have been giving on this show. So we are very grateful that you can make time to join us as and when we call upon you. Now, I'd like us to begin by listening to the president give us the update as Ghana's corona virus situation is. Right after that update, we will suspend talking about the, what the finance minister calls the Santa Claus, interventions that government, has to make. And then we will deal with this issue regarding where Ghana is as far as the coronavirus time clock is concerned. And when is Ghana expecting to begin to flatten the curve? Where is Ghana now, and when is Ghana expecting to flatten the curve? These are important clinical matters that we need to settle to get the most assurance about what is going on. So let's listen to the president first.
105 of the confirmed cases came from those who were mandatorily quarantined and tested on their arrival in our country on 21st and 22nd March. 192 of the cases came from travelers who entered the country before the closure and their contacts. 79% of the 378 confirmed cases are thus imported. We now have in total 378 confirmed cases of infections, with 6 deaths, 4 recoveries, 2 in critical condition, and the remaining 370 are mild cases who are in isolation and either being managed at home or at treatment centers. Fellow Ghanaians, I've come to ask for your continued patience as we continue to implement and extend the efforts that have so far proven to be helpful. It is important that we stay the course and bear with the difficulties that come with it. The final result, hopefully, will be freedom from the virus. So the decision has been taken, through the issuance of another executive instrument, to extend the restriction on movements in the Greater Accra metropolitan area and Kaswa, and the Greater Kumasi metropolitan area and its contiguous districts by 1 more week, beginning 1 a.m. on Monday the 13th of April, subject to review. Our focus on the 3 T's, that is tracing, testing, and treatment. We now see that the decision to close down our borders has been justified. 105 of the confirmed cases came from those who were mandatorily quarantined and tested on their arrival in our country on 21st and 22nd March. 192 of the cases came from travelers who entered the country before the closure and their contacts. 79% of the 378 confirmed cases are thus imported. Clearly, until we have the situation fully under control, we cannot at this time open our borders. They will have to remain shut until further notice.
So that was the president in his 6th address to the nation, doing an extension of the measured lockdown, an extension in time, not extension in geography. We will ask what the effect of all of that is because of the new discoveries or tests in other places that had no cases at the time the lockdown was announced. So I'll begin with Dr. John Amoesi, who is with us on Skype. And Doc, I wrote this question for you. Now we know decidedly that the initial claims of black invulnerability or a level of invulnerability by Africans is false. Minority black communities in America are worse hit or affected, accounting in some places for 70%, like in Chicago, and 41% in Illinois. That's the debt that blacks communities are accounting for. Last week, global infection rate hit 1 million mark. We are now very close to 2 million, and very insignificant recoveries looking at the infection rate and death toll. How are you, scientists and researchers, analyzing this in the face of the increased preaching of the practices of hand washing, etc., and the lockdown?
Thank you very much for that, Samson. And I want to say good morning to all your listeners. And if you just spare me just a couple of seconds to eulogize my teacher, Professor Jacob Langeroux, who passed away yesterday, as you may have heard. A great man, great gentleman by all standards. We're all deeply saddened within the medical fraternity. And I just want to, celebrate him this morning and believe that his legacy will carry on. So thank you very much for allowing me to do that, Samson.
Right.
In trying to understand where we have arrived at this particular moment, particularly with all the information that was going on about race and the fact that black people would not suffer as much from this, was based on 2 things. Well, the thinking that, and this again is based on where the disease started. It started in China and then moved to Europe before heading to the US as the epicenter. And so there was a general thought that, well, it's affecting people who are outside of where black people live in large numbers. There was also the question about the temperature or the weather, and the fact that in Africa, we live in a temperate zone, and so the weather is a lot hotter. And so the thinking was that we wouldn't be affected. Now it's very clear. These 2 fallacies have been debunked. And you can see clearly what you mentioned, the figures in the US with respect to black people. It's a number of things. I mean, if you look at the health spectrum in the US, you realize that black people are often in worse health than the average white person. This is a function of deep-rooted health disparities in the US with regard to access to health health practices, and several other issues. It has nothing to do with genetics in itself. All right. And then the second thing is regarding the weather. And you can see how this disease has ravaged the Middle East and Saudi Arabia, and even the first countries in Africa to have been affected. The first one was Egypt, which is a much hotter place than it is here. In Riyadh, the topping temperatures was averaging 39 degrees, thereabouts, and it's really ravaging the place. So I think the earlier we dispel this notion that the black people, or where it's warm, will not be so much at risk, the better. I think it's already clear by now. And we can see these trends, panning out right before our eyes. I think that's what I'll comment on when it comes to the black person. And you need to understand that this disease affects, the lungs of people, and everybody has lungs, and everybody is made up of pretty much the same constitution. There is nothing special about any race that makes them more or less vulnerable to any particular disease, unless, of course, there are other things involved. And when it comes to this disease, this virus, you need to understand that it's a novel coronavirus. No race has had it before to have said that, we would have some immunity inbuilt, and so we would be less at risk. Nobody's had it before. It's the first time for everybody, and so everybody is equally at risk. We can see it's no respecter of socioeconomic barriers, of any kind of barriers, and it's really important that we get this straight in our minds. That's why I was really excited about your opening part, where you show the medical personnel, nurses, and other allied health professionals all pitching in different languages, trying to educate the public on the need to watch out for this danger, which is right in our midst.
Okay. So we have done about 3 months into the outbreak, and there has been an increased preaching of the preventive measures. Wash your hands, use sanitizers, don't touch your face, and so on. We are doing this very effectively all over the globe. What does that mean in the face of that and the deaths and the infection rate? Just last week, we hit the 1 million mark. As we speak, we are just about to hit the 2 million mark. We are 1,700,000 plus. What does that tell you? What is going on? What are we not doing right?
Samson, I think you asked a great question, because it allows me to explain a couple of things to our dear listeners. And I must mention again that I think the decision by the government to extend the lockdown by a week was anticipated. I'd have been really surprised if the lockdown had been called off. So I'm pretty happy that it's been extended for a week. I'm not privy to all the matrix that's being used in making decisions, but I was expecting a little more than a week based on what we're seeing. Well, that aside, it's really important to understand that when you begin to put in measures, people think that, okay, when we put in measures, we expect to see things getting better. But the truth is that when you begin to put in measures, things will often get worse before they get better. And you can see this in what's happening in many other countries. You will see a higher number of cases. You may experience a higher number of deaths. And it is at the point you begin to see a decrease in the number of daily infections that you can begin to say, all right, we may have arrived at the peak, we may be plateauing, and therefore we are in control of the curve. Right. So it was only expected that we would see our numbers shoot up, and we would maybe see a few more deaths. We're not seeing as many deaths in Ghana and other parts of Africa as is the trend in other places. Now, this could be for a couple of reasons.
Right, and I'll come to you. I'll come to you specific about the Africa situation and the Ghana situation. Why the numbers are not rising as we see elsewhere. Dr. Nsiah Asare and Dr. Justice Yankson, how do you also, analyze the global situation in the midst of lockdowns and active practices of the preventive measures?
Yeah, thank you, Samson. Globally, if you look at the lockdown and the active practices like hand washing, social distancing, and the rest, you realize that the figures are going up. Dr. Amoisi was talking about the figures getting higher, and maybe you term it as getting worse. In our situation, I would say it's not getting worse. You see, the more you trace and test, the more positives you get. If you don't test at all, you won't see anything. People will be asymptomatic, go through the disease, infect other people, and they are also asymptomatic. A few of them will get very critically ill and maybe die. But if you test, you don't only test, you test, isolate, and treat. So when you trace the people, you test them, then you isolate them and treat. It means that you see all those who are positive. You isolate them so that they don't infect other people. And then you also treat, manage them, either at home or in the hospital. Once you do that, and as maybe you'll come to the Ghana situation, that we are doing a lot of tests. It's test. So when you do a lot of tests, by all means the figures will go up. It shouldn't be something which should make everybody worried that, hey, we are increasing the figures. If you ask me the figure today, I won't tell you. The more you test, the better off you are, right? The better off you are. But is Ghana really testing, as you say? We're doing very little testing, really. Comparatively, we are not testing. Ghana is testing. Ghana is testing. Maybe the rate of the samples we've collected and the testing are not matching. But Ghana has so far, as the president said, I'll give you the figures. Since we locked down the 2 cities, the limited lockdown, we've collected samples to the tune of 37,405. And we've tested about 14,000 of it. And I know that yesterday and today they are still testing. So if you look at it, compared to other countries, Ghana is testing. Ghana is testing using the PCR machines. The other countries who are testing with a rapid test. And later I will explain what the difference are. So once you are testing, because all what you are doing now, that we are not waiting for the patients to be symptomatic before you test. That's the difference between what we were doing before and what we've done now, especially at the lockdown areas. So once you continue testing almost in all the regions, and all the regions have also enhanced their surveillance and testing. And now when you bring in a lot of testing size to what we are doing now, then we realize that Ghana has done very well in terms of testing. In fact, some countries are even asking us, why are you testing people who are not symptomatic? But we tell them that this is our style. And I think we are doing the best within our limited resources. So that's what we are doing. So the whole world, if they are testing, they will get a lot of positives. Yeah, so the more you test, the more you discover. And the better position you are placed to treat and to contain. Yes. Because we have tested quite a few more in recent days, we have seen our numbers go up. If you take elsewhere, like in New York, because of the testing they are doing from the 4th, they are able to tell that they have as many as 4,000 plus who died, who got it or something, and then from the 5th you get to know the number, from the 6th you get to know the number, and the numbers continue to rise in the double digit. Because we are not doing as much, we don't know. That's the truth, isn't it? Yes, because we are not doing as much as New York is doing, we may not see the numbers as that. But you see, what we are doing now, we are doing the testing and we are going into communities. In fact, recently what we did in Accra and Kumasi is that we are not doing only for contacts. So you go to a contact that this person is positive, we do all the contacts, and also we go to about 1 to 2 kilometers radius and then try to take samples from people voluntarily. And once you take the test voluntarily, we've realized that we pick 1 or 2, which is a very good sign for us. What it means is that within that locality, if you don't pick anybody at all, it's likely that there's no community spread in that locality. Because if somebody who is positive may not be staying with somebody who is selling cocoa and nkatieh by the roadside. But because he passed there, maybe had an encounter with an Nkatie seller, he then passes on something to the woman or who is doing the cocoa and Nkatie, and then the woman doesn't even know the man. And if you test such a woman and he's positive, it means he has passed it on unknowingly to the woman, and then that's where we say that there's a community spread going on. So far, we are doing a lot of epidemiological survey, we are doing mapping and everything wherever we have tested, and we have spot spores and we have seeding spores. And what we are going to do for the next 1 week with the limited lockdown in Accra, we are going to aggressively go into the seeding hotspots. And then there are some communities which are also heavily populated within this hotspot area. So we go there. That's where the problem is. If you get people getting positive there, because there are so many of them together, because the social distancing doesn't work. So one of the most important things, something, is if you have a very good social distancing. That's the reason for the lockdown in most of the countries in the world.
Okay.
If you are able to let people stay a bit afar, then you are also not allowing the virus to be passed on to other people.
Yeah. So, Dr. Hansen, whilst we are doing all of these things aggressively and we have the lockdowns across the globe, we are still overwhelmed. That's the bottom line.
Yeah, Samson, it is so because it looks like some countries initially did not take the right steps. They hesitated, they felt that, well, this is something that was distant from us. At the time it was China and all that. If you look at the Italy situation, they were one of the first people to have had imported cases from China. But because it was located around the northern part of Italy and there wasn't so much, hullabaloo about it at the time, they were also able to take it to the nearby countries like Austria, Switzerland, Germany, So clearly there was some more or less inertia on the part of some countries to start off with. And by the time they went onto the aggressive testing mode, the whole community had been contaminated with the virus. And that is why we are seeing a lot of cases coming up through the aggressive testing they are doing now. For us as a people, I think we relatively started early. Of course, we could have probably done it a month earlier or whatever, but be that it may, we are in a position now to really appreciate that, look, there is some amount of community spread. And what that means is that we will have to double our efforts, both at the national level in terms of the health authorities and the state itself. And then the general population, our attitude will also have to be reviewed. We need to change some of the do's and don'ts that traditionally we thought was okay with us. And people should begin to appreciate the fact that the disease is here with us. For which reason, we cannot continue life, as we say, business as usual. Sometimes you go into communities to even test people who have actually been positive. You want to get in touch with their very close relatives and what have you. And there's hostilities. So we need to continue to do a lot more of the education. We need the traditional authorities, the local opinion leaders and what have you, to let people understand that the state and the health authorities are working in the interest of all of us. And that if you have to be tested, you have to avail yourself, because if you don't do that, you put the entire community, not just your immediate family, at risk.
Maybe
let me bring Dr. Mwesi in quickly.
Maybe let me add something quickly to what he said. You see, yesterday I saw a very worrying video in Kumasi, where somebody has made a video and spreading it all over that he has seen NIA vehicles going around taking people's sputum. And that from his knowledge, that Ministry of Health and Ghana Health Service has not asked anybody to go and take any sputum. So nobody should go for, allow anybody to take the sputum. You see, this is clearly misinformation. And this is what he said, that if you are not careful, the community will feel that because he doesn't have the disease, he believes that it won't happen to him. So I'm appealing to everybody that when they come to your house, that give us some sputum or give us some what they call it, they want to take a sample from you. It's from Ghana Health Service and the Ministry of Health, sanctioned by the government.
Yeah, so Dr. Mwesi, about this testing, Do you subscribe to the suggestion that we are in an aggressive testing mode? Because that's what we need.
Samson, I think you used the right word. We are in a testing mode. Aggressive is a bit difficult for me to qualify. The reason being, as Dr. Nsiah Asare mentioned, we're doing the best we can under the circumstances, but we have not yet arrived where we need to arrive. That's very important that listeners appreciate that the fact that one is doing the best that they can doesn't mean that it suffices. There is a need for a lot more testing to go on, and we need to move beyond the testing, which is of those who are positive and then their contacts, to even allow those who feel that they might have been exposed or anyone who really would want to be able to have a test. Now, this is a lot more complicated, requires a lot more resources. The question is, do we even have enough test kits? I can't answer that question. So let me reiterate once again, we are doing our best, but it is not enough. I need to tell you a little bit more about this testing. Now, in this testing, we're taking nasal swabs. So what my colleagues who are involved in the testing are doing is they put along like a cotton bud, what you use for your ears. They put it into your nose. Sometimes they go very deep, and they take a sample, they put it into a tube, and they carry it away. Now, you need to realize that this test will not always give you a positive result, even if you are positive. In fact, scientifically, they're estimating just close to about 70%. I cannot be too sure because this is based on a study that was conducted in China and was published in the New England Journal. It should tell you that even if you're positive, there may be a chance that with this nasal swab, you may not show positive.
So this not a reliable method to use.
No, it is. Let me make it clear. It is a reliable method. It is the recommended method, and it's the best we can do here. The most sensitive method is really what we call a bronchoalveolar lavage, which means you actually put a probe down into the lungs, into the little parts of the lung. You spray some fluid there and you suction that fluid, or you take that fluid and go and test it. We just don't have the capacity to do that. It's something that is done, often in intensive care under very specialized conditions. So forget about that. But it's just important for people to realize. So don't be surprised if someone tested negative and later test positive. It could be that they were not yet positive, but it could also be that it was a false negative. Now, regarding the testing, what I really believe we need to do, in order to be able to appreciate the level of exposure that we have had in this country, would be serological tests. When I say serological tests, what I mean is taking our blood samples and testing to see whether somebody has antibodies to the coronavirus. What this would tell you is that this person has been exposed, has come into contact with the coronavirus. Because our testing capacity for the coronavirus by way of taking the nasal swabs is limited, if we really want to have some estimate of how much we have exposed, I would recommend that we have what we call sentinel sites, where we do the serological testing, look at the antibody levels within the community, and that should give us a fair idea. So you have a hotspot, you take blood samples in addition, do serological tests, it will give you a fair idea as to the levels of exposure. We can balance that together with the actual PCR testing we are doing, and it will help us to be able to have some idea of the real picture regarding what's going on. And I totally support Dr. Nsiah Asare's recommendation to everybody to really support the testing. Don't be afraid of testing. Encourage someone who's possibly been exposed to go for a test. When you see the NRA vehicle, the Ghana Health Service vehicle, encourage them, cheer them on. Let's behave like those in Europe who are clapping for health personnel and people are going around. Let's make them feel that we appreciate them and we understand what they're doing.
This analysis brings me to a feeling. Do I feel right when I feel we were a little late in effectively containing the spread by what seemed to be indecision to quickly lock down? How concerned, I'm sure you are not surprised though, how concerned are you about a potential rise in spread across the country, even in communities you may not have imagined or expected to record a case, at least not now?
Thanks, Samson. To say we were late is it's a very complicated thing. Of course, we were late. Everybody was late. This is very clear. Everybody has been late. But the question is, did we make the decision when we had the opportunity or enough information to make a decision? And I can say that, yes, at the point where we had to make a decision and there was enough information, we made the decision. It would have been beautiful if it had been taken earlier. But the circumstances under which we were, the amount of information that was available at the time would have made it very, very difficult. In fact, if we had shut down earlier and this had happened, it would have just been a pure stroke of luck or just mere speculation. But you cannot shut down a whole country based on mere speculation. You have to look at the figures and put in place things before you lock down. So I would have been surprised if even a couple of days had gone past the date which the president announced a lockdown, because I was expecting that it should happen just about then. So I think I would say, based on what we knew and what we had, we took the decision at the right time. It would have been better if it was earlier, but I don't think much would have been done about that.
When you enter the cycle, we are told that you have 2 to 3 weeks before you get to the turnaround.
Yep.
Does it feel like Ghana is actually now entering the circle? When is a turnaround expected? Do we have a scientific basis, given the low numbers of testing we are doing, to project a turnaround time?
No, great question, Samson. And this is exactly the reason why I brought in the serological testing. Now, if you look at our graphs are a bit erratic because we are adding on the numbers as and when we do this enhanced surveillance, all right? So you have a bunch of 10 being added, then you have 1, then maybe we have 15. This is based on what we are doing, the best that we can do. Ideally, you want to see a much smoother curve. We do not have that. And even with our, a bit of a bumpy curve, we cannot by any measure say that we have arrived at the peak, let alone the plateau. And it's difficult to project when we will hit the peak. I have to be really honest with you, based on our limited ability to test. So my recommendation would be, let us include serological tests here, measure levels of exposure. When you have that, it gives you a fair idea of what the reality may be based on your limited ability to test. And only with that can you make certain projections about the level of exposure, the actual numbers infected, and when we might hit the peak. And then that would inform when we could ease the lockdown if we think it is being effective enough. And again, I need to reiterate, lockdown without putting in the measures like social distancing, as Dr. Nsiah Asare mentioned, the washing of hands and all these kinds of things, it's just not helpful because you lose economically and you do not achieve the objectives of the lockdown. So very important to put this in perspective.
All right, so Dr. Nsiah Asare, it took China, for example, 2 months before it started to complete the cycle. What timeline is Ghana working to?
What cycle are you talking about?
Where you start, the trajectory, you peak, and then you begin to flatten.
Yes. You begin to come down, not flatten.
Yes. You flatten the curve.
See, if you talk about flattening the curve, there are two things that you're talking about. The flatten the curve means that you use the number of patients who are positive who have been hospitalized as against the length of onset of the disease. But sometimes people confuse and talk about the flatten the curve also as the number of people who have tested positive.
Okay.
Not everybody who has tested positive is hospitalized. In Ghana, we are lucky that most of the people who have tested positive are either mild symptoms, asymptomatic to mild symptoms. We have very few patients who actually are in critical or severe conditions. So in Ghana, if you look at the flattening the curve, we are not doing badly according to the number of people that we have. Maybe it's because of their immune status, because they are relatively young, because maybe they don't have any other underlying illnesses. But if you talk about the testing, in fact, Dr. Amoisi was talking about the testing. Very soon we are going to introduce rapid testing, which tests the antibodies. What we are doing is that we want to make sure that any test that you are using is a genuine test and it's very specific and the high specificity. So that's what we are doing at Noguchi and the Food and Drugs Authority and KCCR. They are testing because we have blood of positive patients. We use it against any test which comes in, and then we accept the test. Once you start doing that, then we get the antibodies of the people who have been exposed or they are having active illness. We can then tell that this is the number of this area is where we have a lot of people who are sick. But what we are doing now, we are using the PCR test, which we now have 4 sites working. We are bringing on the CSR, we are bringing on the Veterinary Service Division, we are also bringing on the Tamale one, and then also one at Navrongo. Once we bring it on, we can then finish all the tests that we have done. In fact, this morning when I woke up, we are hitting about 44,000 or so of samples that we have collected, that we have tested, only about 15,000 of it. But once you add the antibody test, then we get the numbers, and then we can tell how high we've gone, and then we start. You don't want to, you want to peak and then fall quickly, because once you trace and test, which is a policy of Ghana now, based on science, then we know that anybody who is positive will be isolated, either at home or at treatment center. We don't want to reach a stage where we cannot flatten the curve, where we have a lot of patients coming more than the capacity that we have in this country. Because countries like Italy and Spain and this, and even almighty New York City has even fallen. So that's what we are doing. So that's what I asked the question about, what do you mean by flattening the curve? Okay. And then I've explained it.
Now Dr. Jansen, call it the Corona time clock, 14 days, 21 days, countries are implementing, and lockdowns. What is the science behind it in fighting the disease?
Okay. The first is that the lockdown, there's a reason for it. The main reason is that, one, we want to break the chain of transmission and also contain what we already have. Right. If you don't break the chain of transmission, what it means is that virtually your entire country will be infected. And we cannot afford to handle such numbers. The Italys, the Spains are getting to a situation where virtually everybody is being contaminated. And that is what we don't want. So the earlier you go on the lockdown and your citizens actually obey the rules properly, you have the opportunity to break the chain of transmission, because all those who prior to the lockdown did not have the disease and potentially also don't have the disease in their homes, i.e. maybe your wife or your child may have it, even though the rest of the family didn't know. Then what it means is that all of you in that pool have been taken out of.
So we know that after the lockdown,
yes,
community infections have gone up.
Well,
where there was not infections, we have discovered infections. And we are now discovering in the double digits. My question is, are we not late in the approach? And when are we scientifically projecting to do the curve as other countries are doing?
Well, Samson, it's one of two things. The first is that the issue of being late and all that, I mean, Dr. Amuisi has spoken about it, Dr. Nsiah Asare has also spoken about it. But the cases we are picking in the community, we are picking them not because of the lockdown per se, but we are picking them because of the state's policy as of now, i.e. test. Using science and technology, we are able to zoom or zone areas that potentially have the disease. And then we also encouraging some voluntary testing within those zones. So that scaled up activity is actually what is giving us the results now. Let me give you an example. You see the quarantine group. Initially when they came in, some tested negative. After 14 days, or just about 14 days, we had 26 of them testing positive, even though initially they tested negative. So what it means is that some of these people actually went into the lockdown with the disease, except that they may have been at the early stages, or we have not even tested them at all. So now that we have the opportunity to test them, we are beginning to see the numbers. In terms of when are we going to hit the peak and then come down, I think that it will be very difficult for any scientist to predict now. The reason is that we have just discovered that we have community spread, and we are trying to chase the disease in our community to establish the true numbers. Now, if citizens also don't adhere to some of the measures that have been put in place, as announced by the president himself or the Ministry of Health and its agencies, then what it means is that even within the lockdown period, people will still keep infecting themselves because they are not obeying the rules. Under those circumstances, it becomes very difficult for you to even know the extent of the community spread. Earlier, you mentioned the fact that some parts of the country or regions that didn't have are also beginning to record cases. One is because of the testing. Two, it's also possible that when we had those mass movement of people from Accra to some of these regions, some of the people may have also carried the disease to those places as well. Because at the time, Accra, Kumasi generally were the epicenters as far as the country was concerned. So these are some of the things that we are beginning to grapple with. We haven't been able to define the extent of the community spread in its totality.
So shall we worry about the latest discoveries, including in the Old Fadama slum, news of infected persons evading, quarantine and treatment?
To an extent, that is a source of worry. The reason is that when you begin to escape from treatment and you go to other places, you go and associate with them, you don't also go into self-quarantine, then there's a higher chance that you may be spreading the disease as you move along. As we say, the disease doesn't move. It moves when we move. So if you have tested positive, you are refusing to, in quote, be treated, whether out of fear or out of sheer negligence or whatever, I cannot tell. But what you are doing to yourself is that, one, you are increasing the risk of you yourself getting to a position where you could end up with a complicated form of the disease because there's no form of treatment for you. And two, you are also putting the rest of us at risk because the people around you, as Dr. Nsiah Asare described earlier, using the plantain cellar and all that, you may go around infecting people and they wouldn't know, and they also go home and infect their family, they infect their friends. So at this point, I think individuals should understand that they owe themselves, one, a responsibility, and also owe the entire community and the state a responsibility. Okay. If you have tested positive, please avail yourself so that we go ahead and do
in fact, if you don't avail yourself, you are committing a crime and you could be punished for that. Now, Dr. Nsiah Asare, what are we projecting? Do we have, a scientific way in Ghana by which we are doing the things we do? What is the trajectory that we are working to? Do we have timelines that we are hoping to terminate and open up?
Yes, we have timeline. In fact, everything we are doing, as the president said, is by science. We have a team of epidemiologists. We have divided into strategies. The first strategy was we all knew that the disease was coming from outside. So if you realize, on the 20th, I think the president then closed the borders and then quarantined people who came even before the borders were closed. And as he rightly said, we got 105 positive cases from this. These were potential people who were going to the communities to infect people without knowing. And most of them would have gone back. The next thing that we did, which the president did, was that now let's look at where the hotspots are. And he said that let's lock or limited lockdown of these hotspots. The whole idea, as he rightly said, was for social distancing, so there will not be plenty movement of people in the streets and in their house. Then you stay in your house. But once you stay home, you should also practice the social distancing. Luckily, I'm very happy that Ghana, we have now had a culture where now hand washing by soap and water is a thing that everybody is doing, and then people who can afford are also using sanitizers. Now I've realized people have even started wearing masks. Right. As you have made us wear masks here. Right. Because we have social distancing, but we are wearing the mask. That's your new principle here in this place, which is good. So apart from that, we are now doing what we call mapping. We are doing geographical mapping to see that there's a positive case here. So this positive case who is here, how many people has the positive case contacted and infected? And then at first we were waiting for the person who has a contact with a positive case to develop symptoms. That's what some of the countries are doing. But we have changed that and said that let's be aggressive and enhance this type of thing, and then test them as well. When we tested them, we've gotten, when the president spoke, he said about 77 people have been tested positive. It's not from our normal surveillance system.
All right.
Our normal surveillance system has tested over 192 in Accra, but out of the 190 this and that in Accra, they still have about, Accra has about 52 people positive.
All right.
So that is the importance of what we are doing. Once we introduce, which is very soon, we are asking people who have the rapid test to come in. We introduce the rapid test. Then we can say that, look, this area, this municipality, that's where we have a lot of positive cases. Let's go in voluntarily. Anybody who wants to, his blood to be taken, just a prick, and then within 15 minutes, we tell you your test is positive. Then we know there are two types of antibodies. We have what we call the IgM. IgM means that you are recently exposed and infected. So you are infective, you are positive. Or you have an IgG, which is a built type of immunity. It means you have been exposed before, but maybe the virus is no more in you. What we do, the PCR test then can those who are positive, we then confirm it. PCR test can pick any smallest amount of virus and test that you are still active and you can be effective, and then we isolate you.
All right.
So this is where we can then tell that Ghana has reached a peak. And then once we are isolating and managing, I would say manage, not treat, then it means that flattening the curve is coming in, because you are not taking so many people to the hospital to overwhelm us. And then we achieve what we are achieving.
All right.
And I believe that with the science we have put behind, working together with epidemiologists, with scientists, with geographers, with case management group, we've brought in a lot of people who are advising. We meet them, we get the idea, and we advise the president.
Okay, so let me hear from Dr. John Amwesi. From Dr. Nsiah Asare, who advises the president, it does appear, like he said, everything is based on science, and so they would have an idea and would begin to ease up. What do you make of his analysis of how we seek to flatten the curve?
No, thank you very much for that, Samson. With regard to flattening the curve, it's important to mention that globally, the references to flattening the curve have to do with the deaths. So when we talk of flattening the curve globally, we're actually looking at how many people are dying and what's the rate of death, or the death rate, or in epidemiological terms, what we call the mortality rates. When you begin to see a steady mortality rate for a period of time, and then you begin to see that mortality rate decreasing, that is when you can say that you have flattened the curve or even bent the curve.
Okay.
Now, I can show you what we have here in Ghana. I don't know if it's possible for me to do a screen share on Skype. I'll just try this and hopefully it will work out. I don't know if you can see this clearly enough, but
yeah,
this is our graph of mortality, blue line. If you can see it.
Yeah, we can see it.
Great. And this is the blue line of mortality. This is total confirmed cases, right? So what that should tell you is that it's very, very difficult for us to, at this stage, begin to talk about flattening a curve, because we just do not have that information available just yet. You can also look at the curve of new infections, but we do not have what is in place currently to be able to detect the rate of infections on a scale which you could refer to as reliable enough. So I would say that currently we do not have enough information to arrive at a conclusion as to whether we are flattening the curve or not. The little we have does not suggest that we are flattening the curve. It suggests that we are not doing badly at all. Even if you look at the rate at which our numbers double, it is technically one of the lowest globally. So we're not doing badly. I have to be very clear with that, but I also have to be emphatic that we do not have enough information to begin to talk about arriving at the peak and turning the curve or flattening the curve. That we cannot do at this stage.
Now, listening to the new double numbers, even in the slums, do you have fears that we will escalate?
Well, like Dr. Yancey mentioned, I'm very concerned about this situation. I mean, what do you expect? If someone is infected, if they really are, and this information coming from the Ghana Health Service sources, so I'll have to believe it, much as I would hope it's just a nightmare. But if someone is infected in a slum and is running away, you can only expect that there'll be more people infected and this could easily explode. This is a situation where I believe, and I believe strongly, that government will be extra aggressive, apply perhaps unusual measures and tactics to ensure that all those within that perimeter are rounded up and are tested and are given some amount of care and confinement, because if this gets out of that kind of community and continues to grow, it totally negates all the positives that we have made and could send us, skyrocketing and possibly out of control. I sincerely hope this will not happen, and I believe that the measures are being put in place presently, but it has to be extra aggressive. Dr. Nsiah Asare talked about being aggressive, but for this particular matter, we need extra aggression.
Yeah. Well, I would ask Dr. Nsiah Asare what informed the advice to the president to extend the measured lockdown only in time by 1 week and not geographical extension. What do you think informs that, and how effective is that? At the time we were placing the measured lockdown, there were places that we put the lockdown to that had recorded just 2 or so. Now we have new discoveries in greater numbers, so to speak, comparative by our numbers, and yet we didn't extend it geographically. What do you think informed that? How effective is that?
Is it a question for me, Samson?
Yes, please.
Oh, sorry about that. Yeah, I think what Dr. Nsiah Asare said was right. Doing this, doing it geographically, trying to identify the spots, concentrating efforts where there are positives. He talked about introducing the rapid test, and they're currently testing this at Noguchi and KCCR, where I sit, as he mentioned. What he mentioned was perfectly correct. But my concern as an independent scientist is we just do not have that information that would allow us to make any decisions regarding let me backtrack a bit. We do not have that information which will allow us to measure our curve or to be able to say we are peaking, we are plateauing. Now, the decision to extend a lockdown or otherwise will have to be based on the curves. When you see that you're beginning to bend the curve, that is when you actually intensify your efforts or you maintain your efforts at social distancing and locking down and all the other things. So the extension by a week is fine by me, and I believe the situation will be reassessed. I don't think anyone should blame the president if in a week's time he says, look, we've looked at the numbers and we think that we've got to double down and extend this lockdown. No one should blame the president, because as Dr. Nsiah said, they're going by the science, and the science showed that we needed to push further. I don't see how the science could suggest that, at the end of 1 week, we're good to go. I don't know how that will happen. Maybe there's more I'm not seeing. But for now, we're in a lockdown, and that's good.
Okay. So what informs this decision to only extend the time and not to extend to affect places where new discoveries are being made and made in the double digits?
We see, as we've all been saying, locking down alone doesn't solve a problem. If you lock down and you don't do anything, you have done practically nothing. Once you lock down, you have to look at, you are locking down, and what are you doing with the lockdown? The first 2 weeks lockdown, which will end tonight, was done in such a way that we can enhance contact tracing and also enhance testing and the isolation and treatment. So the extra 1 week that the president said, which he said that after the 1 week he will review it again. So as Dr. Amoisi said, if after 1 week and then the science says that maybe this area, let's also look at the geography and locate this area and all this area. We are not only doing the lockdown in Accra, we've also been preaching the social distancing all over the country. As I said, we have also enhanced the testing in all the regions. That's the reason why we are talking about other regions. Like Eastern region was not part of the system. We had only one case, but now we know that Eastern region, we are confirming the cases to 28. I cannot tell you the figures right now because we are doing some confirmation. And the Eastern region, we know how the thing went to Eastern region. We know the index case from somebody who came from outside in a camp. And the camp, there are about 2 or 3 camps where the person has been to. And those are the people that we have tested.
In Central region?
In Central region, we also know that somebody also went there. It's a contact of somebody. The same thing of Upper East and Upper West, and then Tamale cases were the quarantine cases that we saw. So if you want to lock down the whole country, you know that it also has a social and economic impact. The president has always been saying that we want to do these things and look at the impact on the social life and the economy of the country. You can lock down the whole country, or you can lock down Accra for about 1 month or 2 months. If you lock down Accra in Kumasi, if you lock down about 90%.
What's our number in Central region now?
The number in Central region, as I know, is 1 confirmed case. That's what I know. You should wait until the Ghana Health Service put these things on website. I know that people have been going and listening, and they say nobody announces these test confirmations except from the strong room in Ghana Health Service.
But the regional ministers too have been announcing them as well.
We've been telling them. I don't know why every regional minister wants to go and announce that you have a case. It's good. They are doing education. The most important thing is education. Either you've seen a case.
So if these regions where we have detected or confirmed cases are allowed and they can travel from their place, intercity travel is allowed between them and the other places where there's no lockdown, what are we doing?
What you see, the most important thing, there are some countries who do not lock down at all. And people there, I know a country where they don't have any case because they have a big land, they have very few people there, so the social distancing is there. The most important thing that you should all stress is the social distancing and the hand wash and hygiene, and then sleeping well and keeping yourself.
But you know, social distancing is a luxury in some of these places. You know, particularly in the hinterlands, it's a luxury. And even in some of the cities, we know.
Yes,
it's a luxury.
Yes, I know. But the problem is that, you see, and the WHO Director General has been saying that if you lock down, you don't do anything. You should as well do whatever you are doing.
But if you are locking down, you should lock down effectively.
Yeah, but if you are locking down,
and it should be comprehensive.
Yes, you lock down effectively and comprehensively, looking at the socio-economic situation in the country. You can lock down the whole of Accra and Kumasi, restricted lockdown, nobody comes out, and something. After the 1 week, you come down and about 20 or 50 more people have died from the lockdown. You see, if you look at the economy of this country, about 90% of the people in this country are doing their own job. It's hand to mouth.
That's right. That's right.
So if you are not very careful, it will cause a problem more than...
What do you say? You issued a statement earlier, as in the Ghana Medical Association, and you were actually not looking at, you know, a limited lockdown in the manner it has been done. You appear to have been looking for a nationwide approach. What do you say at this stage? When will we get there, or will not get there at all? It doesn't matter anymore.
Well, I mean, our call was put out there, so everybody knows our position. But clearly, we can also see what government is trying to do. And that does not mean they didn't listen to our call, except that clearly the president is trying to balance the economic and social impact on one side and the health impact. But you can also see that the health impact has also been prioritized, looking at the way government is going about it. Clearly, they want to look at the hotspots at the epicenters and manage to deal with them within our own circumstances as a country. The only problem we have is that it seems to be such that the citizens themselves are not cooperating and obeying properly. The enforcement of some of the measures were a bit lax. And what we recommend at this point is that the president, having taken this decision in his own wisdom, that decision is welcome, but he should ensure that the security agencies and the local assemblies in particular enforce these measures to the letter. Without that, we'll run the risk of what Dr. Nsiah Asare said by quoting or paraphrasing what the WHO boss said, that if you lock down and you don't contain the measures or you don't do what you have to do, then you are as good as leaving everybody to walk around. It is up to us as a people now to ensure that within our own resources and our own, cultural circumstances, we enforce the rules such that we'll all be fine ultimately. If we continue to let people loose, I mean, some of the markets, as of last week, were just like without the lockdown. These places will have to be clearly either closed down or there should be more measures to control activities in there.
Have you seen food being distributed and how the people have had to crowd to receive the food? That's also dangerous.
Yes, Samson, I was involved, or I'm still involved in this food distribution from the private sector COVID fund.
All right.
We initially did about 10 to 15,000 in both Accra and Kumasi. We fairly did our best to ensure that there was some social distancing. But even within that, we saw that it was problematic. But the ones I'm seeing now, I think that we will need to find a new way of doing the distribution of the food. Else, the very things that we are trying to prevent will end up doubling the problems that we are trying to avoid. Reason, even before the food comes, the people have already masked up. At the point of distribution, everybody is rushing to get his. So in the process, we all come up together and then social distances is disregarded. Then when they get their food, they don't want to go home. They still hang around. I don't know whether to converse or expecting that there is more coming. I have no idea. So I think that the distribution, especially the national one, which is actually on a mass scale, the gender ministry, the local assemblies should ensure that they probably work very closely with the military and maybe the police as well, and find a way of demarcating the zones such that you won't have a lot of people moving from one zone to the other, and then when they are in one zone, you have very limited people coming out. If it means they're taking their phone numbers or whatever, you are called or you get to a zone, you are able to gather a few people, you give them their ration, and then you go to the next